Welcome. Today's presentation will be an impactful discussion of how the field of aging and the perceptions on aging are being transformed and manifested over the next 3 to 5 years. You will hear from national leaders about progressive funding strategies, policy initiatives, and how complex root issues on equity and aging is being challenged in the nonprofit community. We had to learn to think and adapt as the COVID-19 pandemic hit all of us, and this is one of the most transformative times that we have been in. The panel will provide their unique perspective on concrete steps that can be taken as a call to action for each of us to have an active role in shaping our future. My name is Orlean Grant, President and CEO of the Juanita C. Grant Foundation. It is my pleasure to co-host this webinar with our partner, the Coalition to End Social Isolation. The Juanita C. Grant Foundation is a national organization that provides programs and services at the local level. This is where it truly happens, where the rubber meets the road. In fulfilling our mission to improve the lives of older adults, we produce 3 programs. The first of which is the Elder Abuse and Fraud Prevention Training Series. We do this in conjunction with our community partners and law enforcement experts, including the U.S. Department of Justice, Elder Justice Initiative, and the Consumer Financial Protection Bureau, as well as the state's attorney and the local law enforcement agencies. We also have the Village Connector Experience Program, which is a national call outreach program to impact and disrupt social isolation among older adults. And our last program is Workforce Development Training and Advocacy Programs, in which we advocate for older adults to stay in the workplace, return to the workplace, and retool themselves for a new adventure in the work culture. It is my pleasure to introduce members of our panel that will help unpack the many layers of society's views and how our journeys as we all age together will be impacted by these transformative trends. Please place any questions you may have for the panelists in the chat. And all resource links that will have been provided by the panelists will be available at the end of the presentation and on the Juanita C. Grant Foundation website. First, we have our town hall co-partner, Jillian Rakusin, Deputy Executive Director of the Coalition to End Social Isolation. Vivian Nava Schlesinger, Director of National and Community Partnerships for the National Council on Aging. And lastly, Sydney Langer, Program Officer for the Next 50 Initiative. First, I would like to introduce Jillian, who would be our first speaker. The Coalition to End Social Isolation has assembled a very diverse group of organizations, policy experts, and researchers, advocates to address the global impact of social isolation and loneliness. Jillian has been a partner and has been able to really bring together an amazing group of individual organizations and coalesce them around this issue. So Jillian, if you could share a little bit about yourself and your experience in the organization.
Absolutely. So thank you so much for having me here today, Orlean, and the Juanita C. Grant Foundation. As Orlean said, I am Jillian Rakusin. I'm the Deputy Executive Director of the Coalition to End Social Isolation and Loneliness, as well as our sister organization, the Foundation for Social Connection. And we are based here in Washington, D.C. The coalition was formed in 2018. It is a multi-stakeholder coalition of consumers, health plans, providers, community-based organizations, employers, tech innovators, and lots more that all come together to raise awareness and advocate for policy change as it relates to social isolation, loneliness, and connection. Our work includes participation in advocacy, policy, promoting awareness, producing evidence-based work, and participating in resource sharing. Our vision is that all Americans have the opportunities and supports needed to be socially engaged in society. Our sister organization, the Foundation for Social Connection, was formed out of the recognition that social isolation and loneliness is severely understudied. So we established a national scientific advisory council of really the leading experts and academics in the field to provide ongoing expertise on national awareness efforts, on policy proposals, federal and state programs, as well as global and national evidence synthesis and analyses. I will lastly just say that Juanita C. Grant Foundation has been an incredible member of our coalition since November 2021, and we are just so thrilled to have the opportunity to collaborate on impactful initiatives like today's town hall. So thank you so much.
Thank you, Jillian. It has been a pleasure working with you and the organization, and so happy to partner with you on this particular endeavor. And now we will switch over to Vivian Nava-Schlesinger, Director of the National and Community Partnerships for the National Council on Aging. Vivian is, I would think now, a long-term partner of the Juanita C. Grant Foundation, and we have been one of their community programs that has been able to really flourish under their mentorship. And Vivian, please share with us your role and your experience in your organization.
Sure. Thanks so much, Orlean. First and foremost, I'm so happy to be here. I'm honored actually to do anything with Orlean Grant and with the Juanita C. Grant Foundation. The work of your organization really does so much to move mountains in the communities that you serve for older adults, whether it's access to services, programs, innovations, and a lot of actual innovative partnerships that you've taught me about. So I know you mentioned that, we've been a long-term partner, National Council on Aging, Juanita C. Grant Foundation, and yes, we have. However, as much as we've mentored you and your organization and the programs that you currently run, I always believe that you've also, and your organization have mentored me in how to approach community, how to talk about community, and the fact that every community ages differently. And we really need to talk about and dig deep into why that is. And the fact that some of those reasons are definitely not the right reasons. It is not right for some of these communities to age in the way that they are aging because of lack of access or barriers. So I just wanted to say that first and foremost. And then thank you to my fellow panelists. It's wonderful to be a part of this endeavor with you, Next 50 and the Coalition to End Social Isolation as well. So at the National Council on Aging, I'm the Director of Partnerships and Network Activation. And what that really means is, at least for me, is making sure that people understand that community is everything and everything else is just everything else. Really, everything happens locally. We've seen through the pandemic that local response is so key. National response, can be what it is, whether it's good, whether it's bad, whether it's quick enough or it's lagging, but it's community organizations that you see are always the first ones to step up. And at the National Council on Aging for more than 70 years, we've been able to lead and build bridges, especially on the policy and advocacy front for generations of families. We've ensured their economic, their health, and their social well-being. And we were the first national voice for older adults who serve them. So for professionals in aging, that these services and programs have evolved throughout the last couple of decades. And I would say, and I know we'll get to it later in the discussion, but in the last 2 years, or the last years of the pandemic, more than 2 years now, have felt like decades for many. They've made us wiser, but they've made us have to really focus on the fact that we've lost a lot. And so how do we regain, some of the strides we made prior to the pandemic, when we know that so many things that existed before, as far as barriers and challenges to people being able to age with dignity, have also been lost. And so there is this requirement that we focus on how to restore what has potentially been lost. And so I'm happy to be here today and talk a little bit more about how NCOA does that. More importantly, how we partner with the Juanita C. Grant Foundation. And then what does the future really look like? What are some emerging trends? And what are some topics that we should make really the hallmark of any discussion around aging? So thanks so much for having me.
Thank you, Vivian. That just puts in perspective where we are today and moving forward. And it's great to see you and work with the National Council on Aging. This brings us to the philanthropy portion of our panelists. And we have Sydney Langer of the Next 50 Initiative. Now, the Next 50 Initiative, I wasn't that familiar with until one of my board members really brought it to our attention, and it's been a breath of fresh air to work with the Next 50 Initiative, who sees funding of nonprofits in an entirely different light. And it was, I was saying, amazement and also surprise that the ease by which to develop a relationship with the organization and with Sydney as my program officer for the Juanita C. Grant Foundation has been a pleasure to be in that company. And Sydney, as a funder for nonprofits in the nonprofit arena, if you could share a little bit with us your role, the view of the Next 50 Initiative and where we are as far as moving ahead.
Yes, thank you, Orlene. Thank you so much for inviting me and Next 50 Initiative to this panel, and thank you to the other panelists as well. And I know I have a presentation that I'll provide later, but I'm happy to kind of give an introduction and kind of a lead into that. But I first wanted to introduce Next 50 because to your point, a lot of folks are maybe unaware of Next 50 Initiative. And we are a Colorado-based private foundation. And we are fairly young. And so we were formed in 2016. And our sole focus of our grant making is on organizations that support initiatives and programs that enhance and improve the lives of older adults and or their caregivers. And so what we've really focused on the past couple of years, and a lot of our discussion today and my focus of being here today is that of a funder. And Vivian mentioned this so well, that all communities age differently. And our view as a funder is to rely on communities to tell us that. And so rather than prescribing specific programmatics or prescribing specific expectations of grantees and what an application should look like, what we're really relying on is a relationship with organizations to tell us what their needs are as it relates to what they're doing with older adults and or their caregivers. And so really shifting the focus away from programmatic based funding to more of a flexible model that allows organizations to address the needs of their communities in a way that works for them and the aging population that they are serving. And so I'm fortunate enough to be a program officer at Next 50 Initiative and partner with wonderful organizations like Juanita C. Grant Foundation and many amongst the nation and specifically here in Colorado as well. So thank you again, and I look forward to this panel.
Thank you, Sydney. So you can see our panel has a wide representation of specialization in the Coalition to End Social Isolation to really original nonprofit, over 70 years old, of the National Council on Aging, leading the nation and really setting the tone for the aging field as one of the oldest, if not the oldest, aging field leader that we have in the country. And then the philanthropy arm, which is so important to nonprofits because we cannot move forward without philanthropy. So we're going to begin with Jillian as far as our first speaker, really concentrating on how organizations can work together on this very complex issue of social isolation among older adults, which is a global issue, and how we're going to get where we need to be in the next 3 to 5 years. So Jillian?
Thank you so much, Orlene. And so great to hear from Sydney and Vivian. Thank you so much for being here with us today. So I think we have some slides to share. If Justin, you're ready to share them. Perfect. Thank you so much. Great. Well, I will first do a brief introduction and just lay some context around social isolation and loneliness and connection. And then we'll dive a little bit deeper into our response and additional ways for you all to get involved. If you can please go to the next slide. Thank you. So we are facing a global crisis of disconnection. Recent studies show that millions of Americans are socially isolated, lonely, or both, which negatively impacts quality of life as well as health outcomes. And I'll get to that a little bit more in the next slide. But things may have recently worsened, largely because of the COVID-19 pandemic, of course, but also indicators like more people living alone or decreased involvement in community groups. While social isolation and loneliness can impact those of all ages and background, we understand that they can keenly impact those in the aging population, largely because often older adults live alone. They might be dealing with the loss of family members or friends, or they might be retired from the workforce, or they don't have as many opportunities to be socially connected to society. Additionally, older adults can experience barriers to transportation with age, as they might lose their ability to drive, operate public transit, or walk certain distances, which again can be a structural barrier. Next slide, please. Thank you. So, many studies have come out linking, a number of co-occurring significant conditions, such as chronic lung disease, arthritis, impaired mobility, depressive symptoms, self-neglect, elder abuse, and exploitation. And of course, there's a very famous study, showing that the mortality risk of social isolation is comparable to factors like smoking and obesity. We understand that high rates of disconnection can cost employers over $400 billion and Medicaid nearly $7 billion each year. That was a study that came out from United and AARP Foundation. As I said, we know that this is impacting individuals of all ages. Through the pandemic, we heard reports that Gen Z is really reporting the highest rates of loneliness in the United States. And we understand that potentially technology has added a complexity to that. Research as recent as this week has come out that understanding interventions from an earlier time point in the life course can really help thinking about prevention of social disconnection as we age. Next slide, please. Something I wanted to make sure we do is also define the terms. A lot of times, social isolation and loneliness get looped in together or lumped in as one topic, but really these are two separate ideas and terms. So social isolation, having objectively few social relationships, social roles, group memberships, infrequent social interactions, and loneliness is really that subjective, unpleasant, or distressing feeling of isolation, a perceived discrepancy between one's actual and one's desired level of social connection. It's important to understand these terms, how they're different, but also how they relate. Social connection is often seen as that umbrella term and also points to the structure, function, and quality of our social relationships. We understand that, the only solutions that will, create impact are those that are multi-sectoral and systematic in approach, which is why we decided to launch the Coalition to End Social Isolation and Loneliness. If you can go to the next slide, please. So as I said, our coalition was born in 2018. Our founder and chair, Andrew McPherson, came back from travels to the UK and understanding what the response was there. Some of you might know that the UK has a Minister of Loneliness, and they also have their own campaign that they're really focused on ending loneliness in their country. And we wanted to make sure that we had something similar to address social isolation and loneliness in the United States. So we started with about 13 members in 2018, and I'm so excited to announce that we just hit our 50th member this month in May. We have taken an extra step in really making sure we have voices from different perspectives, sectors across the life course, sizes, public versus private, research, etc. And so we're really excited that this group comes together on a monthly basis, and then also with some subcommittees to really work on our awareness, on our advocacy, on our policy efforts. If you can come to the next slide, please, it will show some amazing, we call this our logo soup, but we have, incredible organizations working with us in the coalition. If you are interested in learning more about how to join, please reach out to us. We'll make sure to put our information in the chat. You can go on to the next slide, please. I did want to get a little bit more, in depth about our coalition activities. So thinking about awareness, in partnership with Humana, the coalition announced the launch of Far From Alone, which is a public health awareness campaign to address health-related social needs and promote understanding of loneliness and social isolation issues. And you can go to farfromalone.com. We have a lot of similar partners with the coalition also helping with that awareness effort. We also have 2 incredible events coming up this year that you can be involved in. Our first is our Advocacy Day, which is going to be June 15th and 16th. It is in tandem with Global Loneliness Awareness Week, which was started by the Marmalade Trust in the UK and now is expanding across the globe. We will be hosting an in-person event on the 15th in Washington, DC that will also be streamed, as well as our Hill Day, so meetings with different representatives talking about our policy priorities on the 16th. We also have our annual Action Forum, which is our global conference where we invite really anyone that's interested in this topic. But of course, we want to highlight academics, researchers, practitioners, CBOs, private innovators that are working on this topic and helping to address social isolation and loneliness, and also to commit to action. So to make sure that we're actually committing to something we're going to change in the following year as it relates to how we are prioritizing this effort. On our advocacy piece, we do a lot in terms of our relationships on the Hill. Thank you for posting it in the chat. We did a lot in terms of supporting Older Americans Act reauthorization, which passed last year, as well as supporting the Elder Justice Reauthorization and Modernization Act, that is a mouthful, which includes $250 million for AAA's, area agencies on aging, as well as CBOs. That is not yet passed, but we are continuing to push that through. We want to make sure that there is clear funding that is delineated for CBOs and other organizations at the community level to be able to utilize to deploy programs related to social isolation and loneliness. On the evidence piece, we are developing a systems of cross-sector investigation and action across the lifespan, or we call the social framework, with our Scientific Advisory Council. We released the first chapter last month, which is the intersection of the healthcare and public health sector with different levels of the socio-ecological model. So thinking about the individual all the way up to the societal level. What are those intersections? What are those strategies that we can, deploy to really, again, address this issue? We will make sure to, I think it was in the resources page, list the health chapter. We are right now seeking public comment, so it'll be available on our website. We would love any and all feedback on that as we continue to revise that report. Lastly, I'll just mention that we do a lot of resource sharing as well. We have a weekly research report, a monthly newsletter, as well as subcommittees. So one of our members wanted to start an older adults working group. So they come together on a monthly basis and talk specifically about impacts and prevention measures as it relates to older adult populations. Next slide, please. I did just want to cover, as Orleen mentioned, looking ahead 3 to 5 years. These are our key asks for our Hill Day 2022. I just wanted to make sure that they were listed here. I can run through some quickly, of course, establishing a nationally coordinated response to address isolation and loneliness, tying into behavioral health and mental health, tying into social determinants of health, directing funds for public health at the state and local level, including supporting schools and community-based organizations. We understand that school-based efforts is a great context and way to reach children and youth. Addressing the evidence base through funding research, as well as funding for surveillance. So making sure that we're measuring on a grander scale what the prevalence of incidence is so that we can make sure to see what our programs are impacting. And then lastly, requesting the GAO to conduct a study to understand what is happening across the federal government, where are their gaps, where are their leverage points. Lastly, if you go to the next slide, I will mention how to get involved. There are lots of ways, and if you want to talk with me or our team specifically about how your organization can be involved, please follow up with me afterwards. But I just listed a couple here, so find ways to connect deeper in your own community, whether that be through volunteering, joining clubs, launching new programs or partnerships focused on social isolation, loneliness, and connection. Meeting older adults where they are. I know that a lot of our community partners do town halls in their own community, trying to understand and listen from those that they're trying to reach on what would best help them. Integrating with other programs that older adults know and trust, like Meals on Wheels, faith-based programs, Silver Sneakers, signing up for our listservs to stay up to date on evidence and events, joining our efforts on Advocacy Day and attending our virtual action forum, of course, helping us with feedback on the report I mentioned, and lastly, spreading the word on this critical topic. The more that we're talking about this, the more that we set that awareness, reduce the stigma, and continue to do this great work together, we can go a long way. So thank you so much. I will pull up there, and I think we'll get to maybe questions after all the presentations.
Thank you, Jillian. That was very informative and covered a wide range within a short period of time. And I've heard a few things in there that kind of carries over, I think, throughout the presentation. One is that when you come to the older adult population, you have a variety of issues coming on board. You mentioned the technology and the loneliness in Gen Z, and also the technology issue with older adults, and how do you reach older adults who are in that Wi-Fi divide, and that's been a challenge. The other is meeting different communities, diverse communities, marginalized communities that may feel disenfranchised already and isolated, and then how does your organization capture them and bring them into the fold? But one of the things I thought was so amazing and has been amazing in knowing the Coalition in Social Isolation is the research-based orientation that you take. And I think that's one of the key factors, that it's just not a gut level. It's not just, it's in the news. It's not that we're all aware that there's a sense of loneliness, which is different from being socially isolated. But you actually have, the organization has really spent a considerable amount of its resources to bring together a very strong policy and a very strong research orientation, which gives you a leg as to when you're going for funding, this is why we need it. So I think that has been a remarkable and one of the most attractive things about being a partner in that organization. So thank you very much.
Thank you so much, Orleen. Really appreciate that.
And moving towards our national perspective, we did hear from Jillian that social isolation with Medicare costs $6.7 billion as far as expenditures. So we know there's an economic base to social isolation and loneliness. And when you're talking about older adults, one of the aspects I think we have to keep in mind is that that population is large, it's growing. It is one of the most complex groups that can be approached as far as the number of different things that are going on economically, equity issues, access issues, reinventing yourself, aging well, economic security. And this brings us to the National Council on Aging's perspective, which is broad, and how some of this can be unpacked. So Vivian, our last 2 years, 2.5 years, I guess, of the pandemic and its phases has really shown us a lot. And can you tell us a little bit about how the pandemic has shaped some of the services that are coming to the aging population?
Yeah, absolutely, Orleen. And, I read something, I think it was a meme or something on social media that said, for those of you who think we're living in a post-pandemic era, why are your neighbors still getting COVID, right? And so I think a part of that is to really understand and to be very careful in how we talk about the time we're living in now, because so many older adults, especially those that are struggling with health or chronic illnesses or other health barriers or access issues, COVID and the pandemic is still a very, very, very real everyday challenge and fear. And so it's our responsibility as a national organization focused on older adults and adults with disabilities to make sure that we are not just partnering with organizations that maybe have specific focus areas like ending social isolation, like creating digital programs, but that we're making sure that we are very focused on bringing factual information and making sure as much as possible to provide clear information for people to make their own autonomous choices about so many things. And I think that's really, really important to start from is, the question, how has the pandemic shaped aging services? I think it has shaped at least our work. And I'm hopeful the work of the Aging Network as a whole in a variety of ways. Like I said before, when I was introducing myself, in the last 2+ years, it has really, the last 2+ years have really moved the Aging Network or the aging kind of industry of partners to move very quickly in modernizing their approaches to different issues, in talking about aging issues in a very courageous way, especially when they're complex issues involving, oppressive systems that were created and not intended for the people that they, say they serve. Making sure that we're having courageous conversations and we're facilitating courageous conversations around equity and making sure that we're calling out those barriers to access. So I think, the way in which the pandemic has shaped things is that, it is really made organizations have to make their values visible. And, even if you are not focused on making your values visible, society and everything that everyone has been through, the trauma and the loss, and even the silver lining kind of opportunities, amidst the trauma and loss, your values will be visible to people. So what you stand for, who you are, who you're focused on, who you're helping, who you're funding, who you're not funding, all of those things are extremely important. And so at the National Council on Aging, we've seen just a whole host of not just innovations in aging, but I think real moments of opportunity. There's so much that we have to learn, and there is so much that we do not know about certain populations, communities, geographic areas, and we rely on partners to inform our solutions. But there are also things we do know. And these are things that we knew before the pandemic, and things that I hope that myself and fellow, not just panelists, but those in the Aging Network are focused on. And I just want to share a couple of those things, if I may, so that we kind of get some perspective on, what's changed and why innovation is needed. But we really, really need to take steps to ensure that we're focused on equity. We're listening before we're acting, now more than ever. And so we know that more than 25 million older adults are economically insecure, with incomes below 250% of the federal poverty level. What that really means is that most individuals, or most older adults, 25 million, are just one bad break, a fall, a health situation, a lost job, a workplace, situation, one break away from facing significant financial hardship. And many turn to, things like high interest credit options or others to meet basic needs. And a disproportionate number of that population are women of color. 62% of Latinas and 60% of African American women are aging into economic insecurity. So they may not have even started there, but 62% and 60% are aging into, that current state. And so I think even with just facts like that, we can really make sure that we are centering our conversations around not just how we're innovating or what steps we've taken, but what have we known all along, and what do we need to have the courage to discuss now, the courage to partner on, the courage to bring solutions. And I think that's really what it's about. I think more than anything, we need to understand that the tactics and the strategies that can bring about those big societal changes that we know, those improvements in Medicare and Medicaid, the improvements in the social safety net, the improvements in being able to access services, to be able to access benefits, like our Center for Benefits Access and the partnership that we've had for many years with Orleen and her organization. We need to make sure that we're centering those conversations on the populations that we know are struggling most. And so at NCOA, one of the things that we've done is we've created a theory of change, or established a theory of change within how we approach everything that we do. We've made sure to focus on target demographics. We are focused on African American women, African Americans, Latinos, rural, LGBT, and low-income older adults. And so we really, really want to make sure that those target communities, or those focus communities, are ones in which we are having conversations, we are funding programs, we are working with one another to make sure that those strategies are ones that require us to listen before we act. And so, we can talk, and I'm sure we will as the conversation continues, but we can talk a little bit more about some hybrid models that we're seeing through our senior center network. I cannot say enough about the amazing response from senior centers to quickly modernize their approach to providing services and programs. We had one example I'll just say is one of our senior centers that partners with us very frequently as part of our senior center network in New Jersey actually moved their entire senior center to a Facebook page. It's free to access. It's a free resource. And so they thought that would be the most equitable approach. And now, because of what they did, they've actually been able to bring in 20% more individuals into, and I say into, the virtual senior center space. And these individuals are actually a lot younger than generally those that they were seen in person. And so there are a whole host of different things that community-based organizations are doing. But I think just really at the end of the day, what matters is that how the pandemic has changed is that it has no longer made aging services or discussions around aging, it has no longer made diversity, equity, and inclusion the last frontier in aging. It has made it front and center, and it's required that our response meets the need.
Thank you, Vivian. That was riveting. I think I can always count on you to kind of bring us down to what is really important and where do we really need to concentrate. And having courageous conversations is very difficult, but one that we all need to do. And seeing this across the board in different organizations, really going out there a little bit on a limb, because it's not traditionally what we've done, but that it is a necessity at this point. And I think rounding it out with the organization's theory of change targeting African Americans, Latinas, the rural and low-income older adults. We have seen across the country, and we do know in our work in the Maryland area, we've seen transitions of these senior community centers where individuals don't want to go back to in-person necessarily. They are enjoying the hybrid of online activities, of wider range of activities that they can still be at home, but still participate. And it is getting much younger. We're seeing in even before the pandemic, people showing up for older adult activities becoming younger and younger. Mm-hmm. And needing that socialization, that reaffirmation of socialization, and also just being active and involved and moving forward. So thank you for those points of highlighting where we are, where we're going, and also how the pandemic has had a silver lining in putting aging up front, putting up the issues of equity up front, putting up the issues of marginalized communities, and the lifeline that many older adults are living by is very short.
Mhm.
And one slip, as you said, could be the breaking point. So
Yeah.
thank you for that.
Of course. And I just wanted to add, because I think I might have potentially forgotten to queue up my slides, Orleen, but, I was really talking about what I would have addressed. And I just wanted to say to the audience that, one way that is innovation, because we've never really seen it before, not just in our industry, in the aging network, but in others, is to implement equity into your strategic planning. So when you are planning on what you're going to be doing for the next 3 to 5 years as an organization, make sure that every single thing you do touches an issue of equity, and or when you identify barriers, also identify the corresponding potential partner who can bring you a solution. So it may not always be you who has the solution. I think that's very important to remind everyone, is that as a national organization, I truly believe that our greatest strength is in convening others. Our greatest strength should not be in providing every single answer to every single population, because like I think Arlene and I have had conversations where embedded in our equity promise, in NCOA's equity promise, that is a part of our strategic plan for the next 5 years. Embedded in it is that if you want solutions to community problems, ask communities. They will tell you. They know. I think at the end of the day, it's making sure that that is implemented into overall strategy, and knowing that in order to check yourself, if you didn't implement equity in some way or another, in a real way, into your strategic planning, you need to go back and do it, because you can definitely run before you walk, and then you run into situations where you really aren't addressing everyone's issues. So, that's one thing that I think is really important. It's also another thing we're doing at NCOA, and it's important and it's essential to innovating on anything in the future.
Thank you, Vivian. And that is a great segue as far as looking at equity and moving to philanthropy. One of the things we have found in philanthropy, and at least as a nonprofit, in applying for grants and opportunities for funding, is the question of equity, and how does an organization deal with it in the population that you serve, in your goals, in the complement of your board, and activities. So that is a question that's on the table for funders, and brings us to Next 50 and Sydney, who is a progressive funder, and this organization has figured out how to be relevant to organizations that are applying for funding where they actually need it. So Sydney, if you could share with us your philosophy and how this philanthropy role is changing or has changed in the aging space.
Well, thank you, Orleen. And I think that this is a good time to pull up my slides that will kind of lead into a brief presentation. And Orleen, you're so kind to say that we have figured it out, and I will politely disagree. I think that we're figuring it out. We have made some really strong practice changes and are continuing to learn and work with organizations that we serve to better improve our funding strategy to reach communities and organizations that we haven't funded in the past or have historically been underfunded. And so we really rely on panels and conversations and connections to continue to learn and grow. So we are working on it, and I appreciate that warm welcome. So I'll give a brief presentation kind of around Next 50 initiative and kind of where we have been historically and kind of where we see ourselves going. And so some of these things I mentioned in my introduction, so we'll be able to move through the first couple of slides fairly quickly. So Justin, we can go to the next slide. As Orleen mentioned, I am with Next 50 Initiative. We are a Colorado-based private foundation that's dedicated to improving the lives of older adults and or their caregivers. And so as a funder, we support and fund organizations that are improving and sustaining the quality of life for people who are in their second 50 years and beyond. So we can go to the next slide. And just as a brief history, I think in one of our in one of the resources, I provided our website that can connect back to a little bit more about us. But real brief, as I mentioned, we were formed in 2016, which was from the sale of InnovAge, which was a nonprofit PACE provider. And so although that we were created as a independent nonprofit entity, we really retained the focus of serving older adults and their caregivers. So that has been our entire focus in the past, well, since 2016. And so while we are based in Colorado, we do fund nationally. And so as part of our formation agreement, 80% of that initial corpus was restricted to benefit residents and older adults of Colorado, with 20% being unrestricted. And in 2021, we were able to fund and award $12 million in grants that were in Colorado and beyond and throughout the US that were programs, organizations, initiatives, and other innovative programming that was really focused on improving the lives of older adults. All right, next slide. And before I kind of hop into Next 50 initiative, I do really want to highlight another organization that does phenomenal work. And this is the Trust-Based Philanthropy Project. And we have kind of taken and pulled bits and pieces from this Trust-Based Philanthropy Project to incorporate into our culture, our values, and our practices at Next 50. And so I really wanted to highlight this project first and to provide some additional context of the work that we're doing. So the Trust-Based Philanthropy Project, you'll see their website linked on the bottom, but they are really at its core about redistributing power and creating practices, values, guides, suggestions around how to address the inherent power dynamic that exists between funders, nonprofits, and the communities that they serve. And so at the practical level, this could include multi-year unrestricted funding, streamlined applications and reporting, and really focusing on building a relationship that relies on transparency dialogue with funders and nonprofits. And so again, Next 50 has done a lot of learning and soul searching of who we are, what our values are, and how we can incorporate these values that work for us. And a lot of this can be attributed to trust-based philanthropy. So next slide, which is just two brief graphics. And you probably can't see the one very well on the left, but really what that graphic is highlighting the relationships that contribute to the foundation's role and the nonprofit's role in the community, focusing on leaders that are both at the nonprofits and foundations, government entities, and then really working collectively and collaboratively to enhance and improve missions that we're really working to address and create a more equitable society, as you will. And then that second graphic is really centering values around everything that you do as a funder and as an organization, and how your values really contribute to the conversation as it relates to your structures, your leadership, practices, and culture. So again, this is really just taken from trust-based philanthropy, and we've really incorporated aspects of this work into the work that Next 50 initiative does. So the next slide, and this is really what I'm here to talk about, is our Next 50 initiative's trust-based approach. And so, as I mentioned, we're very new. We're a younger organization. And we've really taken the time in the past 5-6 years of grant making to really do some intentional work around listening to what our grantees need what they're seeing in the community and how to best address the needs that they're experiencing in the community. And so in the past couple of years, we've really implemented a funding opportunity that we've titled Flexible Support. And really what our goal as a funder and as a foundation with Flexible Support is providing funds that will help an organization and or programs achieve their goals. And so historically, and with many other foundations, they really focus on a specific program that has a detailed budget, line items, what can go where, and how objectives are met. What we've really learned from our past funding opportunities and the organizations that we're funding is, hearing what do you need if you had money, and how would you achieve some goals as it relates to older adults with said money? And so really shifting it away from you have to achieve X, Y, and Z, and really allowing the space and the opportunity for an organization to assess their needs, to assess the population that they're serving, to maybe incorporate some work around older adults if they hadn't before, to, again, further improve the lives of older adults and or their caregivers. And so why are we doing this? This is really leaning again on that trust-based approach and sharing the conversation. One of our values is learning and mutual learning, and we learn so much from the organizations that we serve. It also allows partnership and collaboration. We're able to provide connections to other organizations that may be in a similar field or in a similar community, and really connect organizations, universities, nonprofits, government entities to really, again, meet some needs that exist in communities. And so, again, this is kind of what we've learned and how we have leaned into some of this more trust-based work, and the way the Next 50 has approached it is with this flexible support dollars. And we've learned, again, a lot from that, which kind of leads me to this next little mini section of emerging trends. So again, our goals are broad as a foundation. We want to be able to support organizations and programs that are doing work as it relates to aging and the aging population. What we have seen in terms of applications coming in and projects that are being done are people really kind of taking that broad approach and tailoring it and customizing it to what works for their specific community. And so within the past year or two, some of the emerging trends that we have seen our dollars be used for is around that partnership and collaboration. So again, we've seen some really unique approaches with organizations that are partnering with other local entities or government entities to meet a need. We have seen a lot of applications and programming come in around multi-generational approaches. And sometimes that is, advancing an intergenerational workforce, or doing a social, decreasing social isolation by combining different generations and doing arts or theater or other community events. And so we've seen really unique and innovative approaches that combine different generations across the board that help further and support a community. The other trend that we have seen is around technology, which I'm sure is not a surprise to anyone on the call, especially in the past 2 years. Folks have really had to rely on technology, and we've seen some really innovative programming and organizations come in around technology, whether that is implementing applications as it relates to fall prevention. We've seen a lot of telehealth and people expanding telehealth specifically to rural areas and rural communities. We have also seen some technology advancements around home health and addressing a home health shortage by utilizing some technology in the home health field as well. And then lastly, we've seen a tremendous increase of communities and organizations really shifting a lot of their focus to social determinants of health. And so what that looks like, again, depends on the community. Some folks are really investing in healthy foods for their community and their older adult population that they're serving, addressing housing and unique ways of approaching housing shortages that are across the board in the nation. And so we've seen a lot of focus there as well. And so again, these aren't the only types of funding that we fund or programs that we fund, but some of the trends that we've seen specifically in the past couple of years as it relates to our flexible dollars that are being spent throughout the country. And so again, I know that we'll have some more conversation about this later on, or any questions that may come up. But as a funder, what we're really relying on is listening. I think Vivian said it really well of, listening before action. And so as a funder, with the resources that we have and providing dollars to organizations, we really want to hear about the needs that are being addressed and in ways that these dollars can be shifted and moved to address those needs as it relates to older adults. So we can stop the presentation there, Justin. Thank you for sharing the screen. That's everything that I kind of had on my presentation portion.
Okay, very good. Thank you, Sydney. That was extremely informative. I hear some common themes coming through from not only the Coalition to End Social Isolation, which is working on the social determinant of health of social isolation, and also the multi-generational aspect, which is we're hearing, as I said, we're seeing younger and younger people coming into the older adult space for activities and services, but also looking at the spectrum that aging begins as soon as you're born, and that we all become older adults at some point, and that's a very gradual procedure. So that multi-generational influence is very important. And then the technology, the give and get on that, if you're lucky enough to have that capacity, but especially in the rural area, that is really borne out to be a savior for a lot of people for telehealth, and the shortage of home health workers is apparent across the board. One of the things that you really said in your presentation was the partnerships and collaborations, which is really important. I just wanted to ask you before we bring the whole panel back, are you seeing that as something in the forefront, with the majority of organizations applying for funding, or are you seeing that as a growing trend, or is already there as a trend?
I think both. I think that it has always existed. People are very resourceful, especially nonprofits working with limited funds, of who can I partner with to achieve similar goals. I will say, especially in the past couple of years, in a lot of these rural communities, specifically in Colorado, and I'm sure it exists other places as well, is these rural communities saying, I have a garden and I would love to be able to rent out a garden to a programming that you have with older adults. And so again, you're really seeing a lot of unique collaboration as it relates to programming that's, again, across generations a lot of times, but is across sectors. We've seen, private organizations, government entities, universities partner with nonprofits to work with a population that maybe they haven't worked with before, or to conduct more outreach to a population. And so I wouldn't say it's necessarily a newer trend. It's just maybe something that we have learned recently and hope to see continue throughout the years.
Great, thank you. And maybe now we could have Jillian and Vivian join us, and we'll go into our questions session and kind of unpack some of these issues that we've been talking about. And just starting with you, Jillian, in looking at the coalition's view, the future of social isolation and loneliness broadly, and in the context of aging, how is CISO seeing that unfold at this point?
Yeah, thanks so much for the question. I think a couple of things. First of all, I think we're all seeing that in this country, polarization is a big issue, and we continue to see trends of division. And we see that across the life course, but I think we want to take a deeper look into systems and structures that have led us to this era of disconnection and see what we can do to put a stop to it. Of course, that's going to need policy, systems, and environmental changes. And we're making sure to approach that, looking through the social framework very systemically. I think we also, understand that the aging population is increasing. I think there's a stat that by 2050, I think 1/5 of the population, 90 million individuals, will be an older adult in this country. And so we want to make sure that there are programs and interventions ready for that time, and that we're starting now, starting those interventions young, and understanding that a different, policy system or environmental approach or strategy may be needed to be looked at differently or adapted depending on the population or even segment of a population. So, of course, we understand that this is an issue for older adults, but maybe we want to even target more closely rural older adults, or those that are, a part of a historically marginalized community. So we really want to make sure to take a little bit more of a targeted approach, as we develop those strategies. I think also another thing to look out for is the movement in technology. I think we're all seeing this, the metaverse and different types of technological advancements coming out. What does that mean for us as we think about social connection? Can we continue to keep the in-person connection strong and foster those skills in our youth as we continue to evolve in a technological standpoint? And then lastly, I think social norms. So I think continuing to push to reduce stigma around older adults, around loneliness, this idea that aging is beautiful. We should make sure to continue to push that forward and include older adults in all of our programming. I think there was mention about intergenerational. This is a big trend that we're seeing. We want to make sure that we're connecting our youth with older adults, and of course, our middle-aged, our new moms, those that are going through transitions, maybe from high school to college to their first job, continuing to make connections between those generations. We've seen really impactful results.
Thank you. I think that intergenerational, multi-generational approach has really been significant. I know we're seeing that in our approach to elder abuse and fraud. Training is to have the whole family and community involved so that everybody is safe. So it's not just the older adults, but it's the grandchild telling their grandmother, look out for this because it's coming down the pike, or this is happening in our community. And certainly the outreach in that. One of the questions from the chat, and I'll just throw this out to the whole panel, was on all nonprofits, community-based organizations have volunteers. And how do we work with volunteers in moving this forward? I mean, that's kind of the army in the community. A board can only do so much. We have set number of employees in an organization, but your volunteers are really the ones out in a day-to-day mechanism in the community. So how can we coordinate and harness that force to move that forward on behalf of older adults and moving these trends forward?
I'll just answer that, just kind of maybe provide a couple of thoughts. And so, at the National Council on Aging, we don't directly have direct service volunteers that we coordinate, so to speak, but we do support community-based organizations that they themselves have volunteers. And they have, like you said, Arlene, these small armies of individuals who day in, day out, or even, every Tuesday and Thursday, every Monday, Wednesday, Friday, are very committed to the things that they're doing to uplift their communities. I think that, in order to really make sure that we're coordinating that kind of service and to continue valuing that kind of service, one, we need to build a bigger table. We really need to ensure that if community-based organizations, at least what I've heard from them, is that when they work with volunteers, it isn't so much to work with a subset of volunteers that are only working with one particular community, but it's really thinking about how to broaden, that shared table. How do we bring in volunteers from different parts of, say, a segregated community? So for instance, a segregated community, racially segregated communities exist all throughout the country. So how do we bring leaders in these communities together to bring their own volunteers to the table to start strategizing about best practices? Best practices is often a term that we use in the nonprofit world. I know many of you that are watching, that's something that you know very well, but there really is a power behind sharing what works in people's communities, and then making sure that, there is this continuous loop of sharing those stories, those examples, those services. And then the last thing I'll say about volunteerism is also what I'm hearing from at least our senior centers is, really thinking about how to reevaluate. We're reevaluating everything in light of the pandemic. And that also includes the way in which we incentivize volunteerism. I've always had a pipe dream of a student loan corps for those who are suffering by the weight of student loans. What if we created a student loan corps where those individuals who had student loans of a certain number, of dollars, and maybe we're living on a certain income level, actually provided volunteer supports for older adults in their community for a certain number of years, much like Teach for America or other programs, and then had those loans paid off because of that, right? And so, what kind of innovations can we think of that meet multiple needs? And so I guess all in all to say that if the need is to bring volunteers together, how do we look at it from different lenses to make sure that we are including different approaches and not just one?
Thank you. Thank you. Which touches on many, many things, bringing us also back to the philanthropy role. And in 3 to 5 years, Sydney, how do you see Next 50 initiative impacting where we're going as far as aging with some of the things that you've heard today, the multi-generational, the volunteerism, the emphasis on equity, and also looking at different aspects within the community through an equity lens?
I think there's a couple of ways to answer that. I think one of the roles that we're really hoping to embody is being a partner not only to nonprofits but to other foundations themselves. I think that we know that private and public dollars are not enough to address the need for aging, and as Jillian and Vivian mentioned, the population that is aging is growing significantly, and the dollars is not keeping pace with that population. And so not only does more dollars need to be invested, both publicly and privately, but how those dollars are invested needs to be changed as well. And so I mentioned Next 50 Initiative had funded $12 million in 2021. That's not even a drop in the bucket of what's needed. We will continue to support aging initiatives and the work moving forward, and as we're creating new diverse funding opportunities, continuing to do that. But there also needs to be an emphasis on other foundations and other funders, other nonprofit funding organizations of not only continuing to give dollars to aging organizations that are focused on aging, but to be flexible with those dollars. To provide unrestricted grants, to provide large donations that are able to be flexible for these populations to use. We know, and again, this stat is from before the pandemic, but we know less than 1% of philanthropic dollars were dedicated to organizations focused on aging. Vivian mentioned one of the silver linings of the pandemic was that kind of the pandemic really shone a light on those deficiencies, and a lot of organizations, foundations, public sector has dedicated more funding, but we would like that trend to continue, again, as we are all aging and growing older. And so that's one aspect. And then I think the other aspect is it is really up to each community to really voice what's happening in their community. And sometimes that can't happen if there is not an equitable way to receive that feedback. And so as a funder, it's one thing for us to say, please tell us how you would like to use our dollars. Please, tell us the need that's happening. We will always welcome that. But there also needs to be intentionality of who's not coming to us, who's not speaking with us. How can we have an equitable approach that's seeking out feedback and going into communities that we haven't funded, that we haven't heard from. And so one thing that Next 50 initiative has implemented, and I've seen a lot of other foundations and organizations implement this, is to have specific focus on community engagement. So at Next 50, we have a specific position that is focused on community engagement. And that role is really dedicated to conducting outreach to folks that we haven't heard from, that hasn't received funding, that works with the aging population. And so really having a two-way approach of not only having an open door policy of come and please talk to us, but also having intentionality of going out and seeking feedback from a populations that we haven't necessarily heard from in the past. And so I think there's multiple ways to answer that, but that's kind of a couple of things that we hope to continue in the future.
Just a follow-up question, Sydney. Do you find in your professional meetings of funders that this is a topic that's being discussed on a majority basis, and so there's a mindset change in how philanthropy is looking at older adult issues? I know you said less than 1% prior to the pandemic. It still seems to be a very high bar to reach to find funders that are interested in older adult issues.
Yeah, I think that in a lot of conversations that I'm a part of, it's foundations in general that they may vary different issues, and so I think from the foundation space in general, a lot is being done around that community engagement and community outreach, and those conversations are happening. I think a lot of foundations, again, could do more in terms of increasing that population to incorporate more older adults. We've talked about multi-generational approaches. One thing that we've seen is foundations or other funding organizations who maybe historically focused on youth programming or the younger populations are incorporating some of that multi-generational approach and are then able to reach an older adult population. So that is an expansion on their part to do that outreach and to incorporate more older adults in their programming. And I think one thing that we hope to do and that we hope that our partners will continue to do is keep pushing that of how can we incorporate more programs that are not only for older adults, but that are also informed by older adults and really receiving that voice and that feedback as well. And so I'm always open for a conversation of how we can get more foundations to fund older adult initiatives, but that's definitely something that needs to advance in the philanthropy sector.
Thank you, Sydney. And then the question for both Jillian and for Vivian, segueing from this, is both your organizations are very strong in policy, lobbying, moving the needle forward with legislation, influencing senators and the Committee on Aging in particular. I watched one segment where testimony on older adult issues were front and center. So if I could ask both of you to address how your organizations, through your policy initiatives, your lobbying efforts, your being able to move an idea through the legislative process is helping these trends that we're seeing and that you're supporting come to fruition in the next 3 to 5 years.
Yeah, I'm happy to start if that's good.
Yeah, sure, of course.
Okay, great. So yes, we've been doing a lot in this area, we have a whole policy side of our team. We have meetings on the Hill with different champions throughout the year. But of course, we also are having this coordinated effort around our Hill Day, which will be next month on June 16th. So we have put together those kind of 6 key asks. And within those, we have identified some key legislation that's already been introduced that we want to leverage and continue to push forward. But additionally, we want to put together some, comprehensive legislation and some new language to put forward on the pieces that are missing. So for example, there has been a substantial amount of legislation around mental health and behavioral health put forward over the last couple of months. It is a real priority for members on the Hill. And so we're continuing to push those forward and garner our support for that. As it relates to developing perhaps an interagency council on addressing social isolation and loneliness, that is something that is new. So we would want to put together some new language around that. So really seeing where we can leverage existing legislation and then where we would like to introduce something, and continuing to strengthen the relationships on the Hill. One of our big champions is Senator Tina Smith, who'll be speaking at our Hill Day event next month. And she has been a big champion and support as we continue to move these different pieces of legislation forward. So that's just a couple examples there, but happy to have Vivian chime in as well.
Yeah, thanks so much, Jillian. I think very similarly, it's really about educating lawmakers and leaders. It's also about identifying champions. And so how do we do that? We leverage our existing coalitions and our existing groups in which we have really relied upon expertise of other national organizations working in conjunction with other national organizations, and then some new initiatives. So we recently launched a equity and aging collaborative. It's essentially a vehicle for equity to focus on particular issues in the next coming years. For the next 2 years, with the support of the RRF Foundation for Aging, we're actually going to be focused on elevating conversations around the Elder Index, a tool essentially to calculate economic security or the lack thereof for populations across the country, brought to the forefront by University of Massachusetts at Boston. And so Orlean and other national, state, and local leaders are a part of that collaborative. We're about now, with the recent recruitment of Generations United, we're about 23 organizations strong, which is really, really wonderful in such a short time. However, with the ultimate goal of elevating conversations, educating, and resourcing stories of how the Elder Index and that calculation of what really defines adequate income for people as they age, and different communities in different geographic areas, rural versus urban and the like. And so, it's efforts like these that are very much tied to our policy and advocacy, I would call hallmarks of our organization. So those hallmarks really are securing and strengthening funding for Medicare improvements, for home and community-based services, and then also making sure that we are strengthening access to benefits and benefit programs for older adults and communities, to include 5 core benefits, that we strongly advocate for. So I think when it comes to policy, it's really about the educational element. Who are we talking to, and what are we saying? It isn't so much to push someone in one particular way on an issue, but it's more about, like I said at the beginning, providing especially older adults themselves, who are at the end of the day going to cast their ballot at the ballot box, or think about an issue in a particular way based on the information they receive. And so if we are not doing our part to educate based on factual information, data, and insights that are coming to us from those communities that data is impacting or coming from, the reality is that we need to continue to share these stories to educate lawmakers and policymakers. And I think that's part of it is whether it's a Hill Day, whether it's our Age Plus Action Conference that we have coming up, our virtual conference in the next 2 weeks, and whether it's previous partnerships with the Next 50 Foundation and others that we've been able to really be supportive of and supported by. It's that continued conversation. Your policy work and your advocacy work should be a continuation of your programmatic work and vice versa. And so at the National Council on Aging, I do believe that that's the key, is making sure that we're working as hard as we can to make sure that all of the things we do connect, and all of them have a reason, for lifting policies that help lift older adults.
Yeah, thanks so much, Vivian. And one more thing I would add is I know that Vivian and I both spoke a bit about the federal level, but of course there's so much to be done on the local and state level as well, that you all can do. So, looking to see who your state, local, city, council people are, looking at the county level, calling upon those representatives to talk to them about the work you're doing, and educate them on this issue is extremely important. And I also will say that although our coalition is at the national level, we know and partner with a lot of coalitions at the local and regional level that are doing this great work. So make sure to reach out to others in your own network, whether that be for-profit businesses, other nonprofits, area agencies on aging, maybe community centers, to come together to create your own local coalitions, and be able to move the needle on some of these aspects. We're kind of greater together. So just another point I wanted to add there.
This point so well taken. I think for all of us in that call to action on all of these issues and policy and the research findings and the economic impact of social that's not so much social, but the economic insecurity and how that just permeates through the entire life of an older individual. In that, I know within the Juanita C. Grant Foundation, we really see economic stability as kind of the cornerstone. Because without it, you'll have home insecurity. You won't be able to manage your chronic disease process, and you might have food insecurity. All the insecurities come into being, and also being vulnerable to abuse and financial scams, as well as just having that stress within your life. So I think it's a point very well taken, Jillian, that we can, within our own resources, our own communities, figure out how to build a coalition, how to start the meetings, and as Vivian said, have those courageous conversations at the community level, and bring in your mayor or your county supervisor, whatever that title might be, to begin having those conversations, because I do feel that sometimes older adult issues get lost in, not that they're not important, returning veterans or returning citizens or youth, the criminal, crime increase, and those kinds of things. This is a huge population that is growing in need and depth of needs of its various issues of health, services, education, employment, socialization, and just quality of life that we all have to eventually start looking at as we age together. And Sydney, I think part of what you brought out is that in the trust approach to funding, and really helping organizations find out and have the money available where they need it, when they need it, for that particular aspect of time to help move these issues forward. And that is something that can open up worlds for the nonprofit world as far as being able to meet the need as perceived by that particular organization. And it has been a wonderful experience having all of you on the panel. I want to thank each of you for an amazing amount of information in a short period of time on some very different perspectives from your organizations and the work you do. I also want to thank everyone who registered and participated and attended the webinar. We're very excited to have everybody here. And if you For those of you who may not have been here but did register, we will be sending out a recording of the webinar, so that will be available to you. In addition, the resource links and the call to action will be available on the website, on our website, and that has been placed in the chat. And I hope everybody goes there and sees the call to action and what can be done from your own vantage point. So I'm going to ask the panel for a takeaway statement from each of you before we go into closing. And I'll start with you, Sydney.
I think my takeaway statement, and this will be a selfish plug, is to we would love to hear from any organization, nonprofit that works in aging or works with caregivers. We're continuing to learn. We're still figuring it out. We have implemented a flexible support model that hopefully will advance, supportive work that's around aging. But we know that there's always more to learn, and so we encourage anyone to reach out to Next 50 Initiative, and we would love to hear from you. And then I'd also, one of my action statements that I mentioned earlier was, reach out to your current funders if you are receiving funding, or if you are a funder yourself, reach out to your grantees to see, other ways that you may be able to support a grantee that's beyond the dollars that they're receiving. And so, really formulating a relationship with foundations, funders, donors, and organizations that are doing direct work. And so that's kind of my shellfish plug to continue the conversation. And thank you again, Orleen, and the fellow panelists for everyone's time today.
Thank you, Sydney, so much. Totally enjoyable to have you. And Vivian, your takeaway statement for us?
Sure. My takeaway statement really is that aging is a social justice issue. And, a mentor of mine once told me that if aging isn't your issue now, one day it will be. And, if we're all lucky, we get to age. However, we know for a fact that not all of us age with the same access to services, access to programs, and access to opportunities. And so what will we do about it? And, my thought really is to ask yourself within your role, within your place, within your time in which you're serving your community, where are the ways that you can really reach back and address this sense of restorativeness that we all need right now. Whether it's mobilizing resources for caregivers, whether it's participating in Orleans Village Connector program, ending social isolation in the ways that you can. Everyone can do something. And so I do think that it's focusing on aging as an issue that is your issue, and it could be your issue in a different way. I know that aging, even without being in the aging network, aging will always be an issue of mine that I'll be able to understand a bit more clearly, because it affects everyone if we're lucky. So really my call to action is to understand that it is the social justice issue that affects us all, and we each have something to do. We each have the opportunity to do something positive.
Thank you so much, Vivian. You always can wrap it up and give us a lot of food for thought, and some pretty complex issues to try to work through in our own organizations and in our own community. Thank you so much. Jillian, your parting statement and takeaway statement, rather.
Yes, absolutely. I loved what Sydney and Vivian both said. And I think it's exactly right. It impacts all of us. I know for me, when we think about social isolation and loneliness, over the last 2 years, just being vulnerable here, I experienced social isolation and loneliness to the max, right? I live alone in a large city. I worked where I lived in a very, very small apartment, and I know that many others experienced what I experienced. And so something that I like to think about and challenge each of you to think about is, what types of connections, social connections, do we want for our futures, and how can we improve our social networks as we age? It's really crucial as we think about each one of us us is aging. I know we've all said this, right? So how can we continue to support these innovations that promote healthy aging while also addressing SDOH indicators like social isolation, loneliness, and connection? And I piggyback off what Vivian said as well. We each have a role. There's each, we each have something that we can do. Really glad to have this passionate group here that's ready to commit to action.
Absolutely. And I guess my takeaway statement is we all have within us the ability to affect change. We all have it in our ability to talk to our neighbors, to be active in our communities, to take a leadership role, and to start conversations and to see what is possible within your own reach. And, we're returning to the work world. Even if you're in the office maybe 2 times a week or 3 times a week, or you're still on Zoom, it's a time where you can start conversations and start, bringing that awareness to the table about um, elder justice issues, the different communities, the outreach we need to do, the coordination of volunteers, the coordination of organizations to make a difference in moving these trends forward for all our benefits, because we are all going to age together. We all are aging together. And with that, again, it's been a pleasure. Thank you, everyone. And Jillian, you have the closing comments.
Thank you so much, Orleen. Thank you, Sydney. Thank you, Vivian. What a fabulous, session and webinar we had here today. Orleen, we just wanted to say, thank you and the Juanita C. Grant Foundation for your leadership and good stewardship. The work of your foundation is really a wonderful example of community-led action and advocacy. So thank you so much for your leadership. And we hope that after absorbing what everyone heard today, you'll consider how to implement some of the learnings in your own work, and please share back with us your thoughts and feedback. And we hope you enjoy the rest of your afternoon.